Hello friends, welcome back to my channel Dental Minibytes, Basics to Mastery about all dentistry related educational videos. So this video is about mechanisms of bone growth, and there are two things. One is endochondral ossification and the second one is intramembranous ossification. For endochondral ossification, I have a separate video in my channel, so please click on the link above to visit the endochondral ossification. And now we are going to see about intramembranous ossification. For a easy thing, I have separated this into three stages. One is mesenchymal condensation, differentiation of osteoblast into osteoid, and establishment of ossification. So intramembranous ossification is that in this type there is no cartilage precursor, whereas in endochondral calcification there are cartilage precursor is present, which is converted into bone. But here there is directly laying down of fibrous membrane. So in that fibrous membrane, the bone formation will take place. So we can move on to the steps now. The first one is mesenchymal condensation. So the mesenchymal condensation will take place initially. This forms the basis for bone formation. So once the mesenchymal condensation takes place, there will be formation of osteoblast, which is moved above and it occurs at a superficial layer. So then the second step is differentiation of osteoblast into osteoid. Once the osteoblast is formed superficially, then there will be synthesis of collagen fibers in between the mesenchymal condensation and the osteoblastic layer. So this cells collagen fibers, and this collagen fiber starts to increase in size so that bone formation will proceed. Then once the collagen fibers are formed, the osteoblast cells will secrete osteoid formation. Around these collagen fibers, the osteoid formation will take place. So this osteoid will like an gel, or it is a gel matrix. So it flows in and around the collagen fibers and surrounds the collagen fibers. Once it flows in and around, this osteoid causes calcification to form oven bone or bony lamellae. Few osteoblasts might get entrapped within this bony lamellae, and this become osteocytes. So the remaining osteoblast, what it does is, the remaining osteoblast will move on to the down layer, and above which a new osteoid layer is formed between the osteoblastic cells and the perichondrium. So this layer is the perichondrium, and below is the lamellar bone, that is newly formed bone, and the osteocytes will get, osteoblast gets entrapped in this lamellar bone that forms the osteocytes, above which a new additional layer of osteoid layer is formed. So again this layer becomes calcified, and once again the bone layer will be forming. So like this addition of layers will happen, and subsequent layer will got ossification, and then another layer will be formed. So it goes like that. So addition of layer by layer to the existing bone, this process is called as appositional bone growth. That is, appositional is nothing but successionally the bone is laying down. So this type of bone growth is called as appositional bone growth. So this is all about the steps in intramembranous ossification. And one more thing, I just want to give a different ossification process in different bones. That is, in face, purely intramembranous bone is maxilla and nasal bone, and pure endochondral is not present. Both endochondral and intramembranous ossification takes place in the mandible, because the mandible is formed by the Meckel's cartilage. That is, Meckel's cartilage will be formed, and in and around the Meckel's cartilage, the mandibular bone will be forming. Then in cranial base, both endochondral and intramembranous ossification takes place in occipital bone, temporal bone, and sphenoid bone. But for ethmoid bone, it is purely cartilaginous. That is, cartilage is converted into bone. Then in cranial vault, only intramembranous bone formation will be there. There is no cartilaginous precursor. One is parietal bone and the other one is frontal bone. So this is all about the differences and mechanisms of bone growth. So we'll see in the next video. Thank you.